First of all, thank you everyone for joining us today and welcome. I am Federica and I am the secretary of the Young World Federation of Public Health Association Working Group. And I am honored to open this important session today, Raising Youth Voices, a discussion on equity and decolonization in public health as part of the different events that we are co-organizing for the Global Public Health Week of this year, the fourth edition. Today's webinar is actually the result of an incredible collaborative effort among several youth-led and student organizations, the Young World Federation, as I was mentioning, the International Pharmaceutical Students Federation, the International Federation of Medical Student Association, the International Veterinary Student Association, the Euro Public Health Student and Alumni Association, and the Health Diplomacy Youth Network. And we are all here united by a shared commitment to advancing and advocate for equity and decolonization in public health. It's also important to say that this session is actually built from last year collaboration for the Global Public Health Week. Last year, we organized a webinar, and over the year, we were also able to collaborate and write a youth manifesto on youth empowerment. And so this year, we actually wanted to then move forward from all the reflection that we did last year and move more on action and increase the discussion that we're having together. And together today, we aim to align the voices, the perspective, and the solution driven by young professionals across the globe. You heard a lot of international, and focusing on the two key pillars, equity and decolonization. And we are very excited and happy to have today with us Emma Rausonte-Patu, the president of the World Federation of Public Health Association, that will help us to set the context around the two important themes. And over the hours, we'll also hear from youth representatives that you see with me today. And we will have a dynamic and engaging panel discussion. We will also discuss the result of a survey that we were circulating over the weeks, where we try to collect experience and insight from young people and in public health. So thank you so much for being here, and I just want now to leave the word to Bonnie and to continue to our webinar. And thank you so much for being here.
Good afternoon, everybody from Poland. I'm joining from Poland, and thank you, Federica, for kicking off this webinar. As Federica mentioned, we are starting today with a keynote message, And before we give the floor to our speaker, let me say a few words about her. Our speaker today hails from New Zealand and holds the distinction of being the first Indigenous person to serve as president of the World Federation of Public Health Associations. She is a seasoned public health leader with experience spanning cultural responsiveness, organizational development, research, coaching, health promotion, and healthcare management. She earned her bachelor's degree from the University of Canterbury and her master's degree in public health from Auckland University of Technology. She also currently serves as the World Health Organization expert advisor on the commercial determinants of health. With her wealth of experience and deep commitment to health equity, she is exceptionally well placed to talk about equity and decolonization in public health. Let us all give our full attention to the keynote message of our distinguished speaker, Emma Rausonte-Patu. The mic is yours, Emma.
Ora, tēnā koutou. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Tēnei te mihi kia koutou katoa huri noa I te ao. Tēnei te mihi anō nei ki ngā iwi take huri noa I te ao. Ko Waio ko Ngāti Ranginui, Ngai Te Rangi Raukawa me Ngāti Haua, ko Emma Waimari Rausonte-Patu I tōku ingoa. So, hello to everybody. Well, good morning, good afternoon, or good evening, depending on where you are streaming in from or observing from. I am Emma Rausonte-Patu, and thank you very much for the lovely welcome. It's a real honour to be invited to speak on this webinar today for Global Public Health Week 2025. on the invitation of course, young WFPHA and the rest of the partners in this webinar. And it's my honour to be here to be able to contribute what I can to this space and the conversation. So yes, I am the first Indigenous woman, first Indigenous person to be the president of the World Federation of Public Health Associations. And it's really important to start here with that part of the conversation, because what we're really talking about when we are understanding what it means to decolonise is we're understanding what it means to centre the voices of Indigenous peoples in the places where decisions get made. And so my very existence, in terms of the role that I'm able to play, demonstrates the commitment of the Federation to understanding their roles and responsibilities to decolonising public health. Again, what I'm really here to talk about is the commitment of the Federation to decolonising public health and why it's important. As an Indigenous person, I belong to 500 million people on this planet who identify as Indigenous or come under that title of Indigenous peoples. I also come from a first world country, so New Zealand, which has an Indigenous population, which has one particular face of indigeneity and one particular face of colonisation and what that looks like. What we know that Indigenous people across the planet all share is an unequal burden of illness and disease. And so when I say that, and I'm trying to kind of use the simplest explanations around describing the subject matter, because it is very nuanced, it is a very large area to be able to try to attack. So I'm only starting from what I would call the very beginning. So Indigenous peoples face the greatest burden of illness and disease on the planet. An example of that is that young people in New Zealand, the country I come from, when I say young people, young Indigenous people, have some of the highest rates of suicide in the world. And so this is only one demonstration of the types of inequities Indigenous peoples face. Another one that I can point to is when you're looking again at the Western Pacific region, the inequities that Indigenous people in the Pacific face in terms of their high risk of becoming climate refugees. So when we think about where these inequities came from, they came from the colonial systems of power that imposed themselves on just about all the places in the planet, that removed the inherent rights of Indigenous populations to the way that they determine how well or not they are, depending on the access that we have to those things that determine our wellness and our spiritual happiness and our place on the planet. And so when we talk about decolonising, we need to be really truthful in understanding the process that occurred to Indigenous peoples, first and foremost, because that's the beginning of the story. And once we understand the initial beginning of colonisation, then we can really understand the nuances in all of the different places where colonisation continued to occur to different peoples over time and still continues today. And when I say still continues today, the consideration of the political determinants of health that determine how resources distributed. And when we think about decolonising public health, we do need to talk about things like institutional racism, because institutional racism is the setup within the systems that come from the colonial systems of power that perpetuate the inequities based on one people's or one group of people's power over another. So institutional racism in its definition is either inaction in the face of need or the unequal distribution of power that advantages one group of people over another. Again, when we make these statements, we can look at the statistics, we can look at the facts, and we can see where the greater burden of inequity exists, and by and large it's with Indigenous peoples across the planet. So as public health people, and I'm going to speak from public health position, public health people on this webinar today, we all understand the importance of the statistics that demonstrate the burden of illness and disease. So therefore we can see that there is a problem and where the problem sits. It then becomes about acknowledging that, and then what are the actions that we need to do to be able to address those inequities that we know continue to exist and continue to be perpetuated. The good news is we all have a role to play. And in saying this, it's about understanding our role and our place in the decolonial picture, and then how we can learn about actions and then perform actions that are going to help to undo the damage that has been done by the colonial structures. A big part of this is each and every person who practices in public health, and I'm going to focus on public health for now, understanding their own historical context, understanding their own contemporary context, and then being able to accept that these challenges that we make around the need to decolonise are very real, and it's really just a way to describe inequity and how inequity exists, and then find ways to address those inequities. And when I say that, I mean authentically address the inequities. And these are some of the things that we face on a daily basis, is people want to address the inequity, but often the challenge is too great for some people to lean into. And I think this is, in many ways, the opportunity for our young professionals, our young people, our youth, because you bring a different sense of a feeling of how possible change can be, and different ways to create opportunities for change, and then actions for change, and leading into actions for change. And this webinar is an example of that. So again, I go back to, the most important part of the puzzle in all of this conversation around decolonising public health is people. It's people understanding their historical context. It's people understanding what are the right actions. It's people having relationship with those most affected so they can understand what those right actions are. And then it's people being brave about being able to implement actions that we know to be those that work. And I say this as a kind of a lasting note in what I'm wanting to share, is that for many generations, our peoples have said we have the solutions. We have the solutions to the inequities. We have the solutions to be able to transform systems into those that create equity by their very nature. It's just that people haven't heard us. And so I'm inviting you all to be part of the movement, to support Indigenous voices, to be centred in all the work that we do, in all the places that we sit, because if we do the right thing for Indigenous peoples, we only raise the wellness and outcomes for everybody else. So I think that's enough for me, and I'd like to hand it back to the chair. So thank you very much for having me, and I'm very happy to stay and be part of the discussion going forward. Kia ora.
Hi, thank you so much, Emma, for your brilliant remarks about, setting the stage and context about, what decolonization means for individual people, and what is the role of our own individual history when it comes to even understanding the part of world where we belong, and what part of world is even accessible to us, and how the rest of the world can be accessible to us as young people as well. So I think that is a very clear context. And I think it will resonate with a lot of young people around the world as well, who are trying to do great things wherever they are. But then they are struggling, I think, to find the means to be a part of the bigger conversation as well. So I think that's a great setting, and I thank you for those remarks. And so I think we can, open it up for some questions from the audience as well. And while we wait for people to share your questions in the Q&A aspect of the Zoom webinar, there's a question. There's just a quick follow up from the remarks that you left that comes to my mind, is that how can institutions all over the world create an ecosystem for youth involvement and leadership? So what is the role of institutions to create ecosystems wherein youth voices can be heard, but not just heard, but opportunities for them to be right at the center of leadership when it comes to conversations that affect the health issues that are most crucial for young people? Yeah. Thank you so much.
Thank you for the question. I think in many ways the answer is an easy one for me. It's, when you're thinking about sharing power or sharing, spaces for decision making, it's acting from what I describe as a partnership approach. And who are the partners in the way in which you operate as an institute or an organisation, or even just in an individual relationship? But how am I acting as a good partner in this relationship to those who need to have their voices heard the most? And obviously in this conversation, we're talking about centering the voices of young people. And it's the same thing when we want to centre the voices of Indigenous peoples. How am I acting in the best way to demonstrate partnership, co-decision making in its truest sense? is kind of like the best answer I can give. I mean, you kind of answered it yourself in many ways, but it's that partnership approaches to decision making, and this is something that I think we can all lean into.
Okay, excellent, excellent. And thanks for sharing that. And I think the various organizations that are present here on the panel are precisely based on that partnership approach when it comes to working closely with youth from all over the world with various regions, various contexts, and various professional backgrounds as well. So I think that's a great input into, even just recognizing the work that, youth organizations all over the world are also doing in terms of building those partnerships. And yeah, I think just as a quick follow up to also better understand when you speak of those things and coming from first we start thinking of how can institutions be the source where youth can organize, and that is I think the first aspect of the conversation that we are at. But for many young people, those institutions would also seem very far away. So even in terms of very individualized action, when it comes to people all over the world from various professional backgrounds, from various educational backgrounds, various literacy backgrounds as well, various socioeconomic profiles, people in conflict and humanitarian situations as well. If they have a pressing health issue in mind that they have observed in their own communities and want to solve, what is the advice for young people that you would have from all over the world? What is the starting point for them, and how can they go about bringing that impact for the problems that they are observing in the communities where they are?
See if I've got an answer to that question. Again, I think so there's a couple of things, right? It's about the provision of choice and how we are able to see the provision of choice for people for whatever it is that people need in their communities across the globe. And for a lot of reasons, there are many barriers to choice for in many ways. Every country has its own context. But I think, again, it goes back to the idea of partnership and co-design, collaboration, greater collaboration and sharing resources as well can help us to get the things that we can't get, particularly if there are political barriers. Political barriers create competition for resource and the creation of new kinds of the provision of health services, particularly. So it's how we, I guess, a kind of activism in the face of the political determinants of health is how we come together to share and get over the barriers of competition between us, and then are able to co-design and create new ways and new choices of health service delivery and options for peoples in our communities.
Okay, yeah, excellent, excellent, excellent remarks, Emma. And I think that puts us very neatly, towards the next segment of our webinar as well. So I would like to hand it over to Federica to take it ahead and start the conversation around what we've gathered from various from the survey that we've done, from the various organizations that are playing a role in this space as well, to build upon the context that you've set for us. So I think I'll thank you here for the remarks. I'll thank you for your time to come to the webinar as well, and for setting the right stage. And yeah, over to you, Federica.
Thank you. And I will just say again, thank you for Emma speeches and answering to our question is very interesting, and we need this conversation. I am just gonna let Nadia from FCA now taking the lead and presenting the result of the survey.
So before we begin our panelist session, I'd like to give a quick overview of the group based on your response. So I'm Nadia from IVSA Standing Committee on One Health, and this survey gives us a valuable insight into the perspective and experiences we bring into this space. So the first one is the familiarity with health equity. We ask you to rate your familiarity with health equity on a scale from 1 to 5, and the majority scored themselves at level 3 to 5, with 6 respond at level 3, another 6 at level 4, and 5 at level 5. So this suggests a very strong foundation awareness across the group, with room to deepen our collective understanding. Then the next one is the engagement in decolonizing public health. So when it comes to engaging with decolonizing public health, responses were mixed. 9 participants indicated yes, while 7 said no, and 2 selected maybe. So this reflects a very wide range of experiences level, and also openness to learning, which is ideal for rich and layered discussion that we are going to have with our panelists. Then for the age distribution, the age spread is also diverse. So 6 respondents are in their 20s, and 7 are in their 30s, and 5 are in their 40s or older. So this generational range will bring valuable intergenerational insight and perspective into today's conversation. The next one, we also collect your educational background. There is like diverse educational and career stages represented. So there are 5 graduate students, 8 early career professional, 1 mid-career professional, and also 1 undergraduate student. And this mix will allow for cross-sharing of academic and practical knowledge. So the next one is field of study and work. Unsurprisingly, public health lead the way with 11 respondents identifying it as their primary field, but we also have voices from medicine, veterinary medicine, the social sciences, and technical study, reminding us that health equity work must be interdisciplinary. Then the affiliation with youth association, since this is a collaboration between association, there are diverse association present here. So there are 10 respondents are affiliated with youth associations such as Young World Federation of Public Health, then IFMSA, EPSA, and other. So this affiliation reflect an active commitment to leadership, advocacy, and youth-driven change in health system. And we also asked you about the definition of health equity in one word or phrase. And you guys' responses included opportunity, fairness, justice, dignity, needs, and accessibility, terms that speak to a collective desire for system grounded in human rights and also social justice. Following that, we also asked you like what is the barrier to achieving health equity, and we have like 4 response for this. So the first one is the systemic racism, then the second one is the colonial influence in curricula, then the third one is the lack of diverse representation, and the last one you put is the socio-economic barrier. So this highlight the deep structural change needed to achieve equity in health. And lastly, we asked the goals for the webinar, and all of you expressed a shared interest in learning strategy to address this barrier, then understanding the role of colonial legacy in global health, then gaining insight into policy for equity and building network with other young leader. With this context in mind, we are well positioned to explore, challenge, and build together.
Thank you so much, Nadia. I think we can now move on to the next section of our program today, which is the panel discussion. And so for this, this is where we bring in us youth representatives from our different organizations, and then we'll have a wee chat about what organizations are doing around the topic of decolonizing global health. And we'd love to hear your voices and your questions along the way. So please put in any comments, put in any Q&As into the chat, and we'll have a wee look at them along the way. I think to start off though, it'll be quite good for maybe the audience to know who is here and who we're representing. So I guess I'll start off with myself. My name's Dr. Alex Chung. I'm Alex. I'm representing Young WFPHA, and I'm part of the comms team. So I'll be moderating this panel session today. I'll just go down the list. So Mark, do you want to give a brief introduction to yourself and where you're from?
Hello, everyone. I am Mark Allen Guman from the International Pharmaceutical Students Federation, and I'm currently serving as the Public Health Activities Coordinator, in which, through my involvement in IPSF, I have been luckily working or have worked with various partners such as UNAIDS, as well as the World Health Students Alliance, in leading public health initiatives such as the Global AMR Youth Summit and the High Five for HIV project just recently. And I'm happy to be here and happy to be joined by such esteemed panels here today. Thank you so much.
Hi, everyone. My name is Zainuddin El-Miqati. I am the representative of the International Federation for Medical Students Associations, and I'm part of the international team for the Standing Committee on Public Health, where I work in the external affairs aspect of the Standing Committee. I'm a fifth-year medical student from Alexandria, Egypt, and I'm really excited to be part of this panel where I will get to share with you our point of view as medical students and as future healthcare providers on this very important aspect of decolonizing global health. And I think it's a really important theme. And we heard a lot from Emma about this very important topic, and I can't wait to get more into it with you all. So thank you so much.
Hello again, everybody. My name is Jaime Bonifacio, but I go by Bonnie. I'm from the Philippines, where I spent several years working in health program management, quality improvement, and health system strengthening. I'm currently pursuing a dual master's in public health through the Europub Health Program, which brought me to the United Kingdom, specifically the University of Sheffield, and now to Jagiellonian University in Poland for my second year. I also serve as the president of the Europub Health Students and Alumni Association. So I'll be bringing my perspectives as a student and as a public health professional in our discussions later. Thank you.
So my name is Abhishek Bhatia. I am from New Delhi in India. I am representing the Health Diplomacy Youth Alliance today. I work as a policy and advocacy consultant with the Alliance and also as the chair for the Health Diplomacy Youth Network. And I'm happy to bring my perspective about what the Youth Network does for bringing in more youth voices right at the center of policy advocacy and diplomacy of global health, and also what it means to decolonize and have more equity in public health. So yeah, looking forward to the discussion and happy to be amongst great peers from good organizations around the world. Yeah, looking forward to it.
Great. So yeah, let's kick off the questions. We've heard from Emma, obviously, about the importance of why we need to be talking about decolonization and the injustices that can arise from not looking at our histories and not addressing these inequalities. Injustice and justice, choice, opportunities, those are words that have been coming up in our survey and obviously are very important for young health professionals around the world. I guess my first question to the panelists is, what does decolonization and health equity look like in your organizations? So I'm going to start off with Zain on this one, actually, because you were raring to speak earlier, so I'll let you have the floor on this one first.
Perfect. Okay. Thank you so much for this question. For IFMSA, for medical students, we are 1.5 million medical students strong, which means that we represent medical students from all over the world. So decolonizing global health for us is very, very important because for us, it is central to everything we do in our work, whether it's in advocacy or within our internal capacity building campaigns. We need to make sure that everything we do is centered in that mentality where we focus on always being inclusive in our work, always advocating for shifting from neo-colonial attitudes in decision-making processes. And while also we recognize the historical injustices, and that way we can promote more equitable actions, whether it's through our activities, our capacity building workshops, or our policy documents as well. IFMSA has a strong stance on decolonizing global public health through our policy documents and our policy work. So for us, we just would always advocate for eliminating all the barriers that hinder inclusivity and social responsibility. So that is why it's very important for us.
Yeah, and barrier breaking down as well is another key aspect that was really brought up in the conversation. And how are our other organizations doing this? How's the Health Diplomacy Alliance sort of tackling this issue?
Yeah, thanks for bringing me in. And so I'm happy to share that for the Health Diplomacy Alliance, the Health Diplomacy Youth Network is embedded right into the bylaws of the Health Diplomacy Alliance, into the advisory board of the Health Diplomacy Alliance. So just as Emma mentioned, the partnerships approach for bringing youth right into core decision making. So I think at the Health Diplomacy Alliance, what we've tried to do is bring youth bring the youth network directly into the advisory capacity of the Health Diplomacy Alliance so that it influences, shapes, and informs the type of work that we do. Right at the right at the core of everything that we're trying to do. So at the Health Diplomacy Alliance, we are following both a top-down and bottom-up approach towards health diplomacy. We work together with grassroots and coalitions of organizations to raise their issues at WHO and various other international political forums, at global discourses, but we are also bringing down the global discourses and the global political commitments, such as the high-level political commitments on AMR, down to the national level and the organizational level to then, try to make sense of diplomacy in both ways, so that there is, policy advocacy, diplomacy, but also implementation of whatever conversation is happening. And the way the Health Diplomacy Youth Network is currently structured is that it is of youth, for youth, and by youth. So it has its own bureau, which is currently up and functioning for the 2025-2026 term. My role is there, purely to provide oversight and strategic support towards them, towards facilitation of the program of work implementation that the youth network has created. So the opportunities that they receive is that they receive opportunity to be part of an interdisciplinary team of members of the Health Diplomacy Youth Network. So they are really having conversations with people from public health, medicine, veterinary, but also from various other fields, which is international relations, political science, economics, environmental, social sciences as well. That is the first aspect. Second aspect is they are bringing up their own initiatives that they are organizing in their own communities via the blog of the Health Diplomacy Alliance, and popularizing and bringing it to the fore the activities that they are doing. So that is the second opportunity that youth receive as part of the youth network. And the third is, being part of the events that we are organizing, but also representing the Health Diplomacy Youth Network at various events in their own regions all over the world. So those are the three types in which the Health Diplomacy Youth Network is currently engaging right at the core of the Health Diplomacy Alliance in the various work of negotiation, event organizing, drafting policy briefs, working together with member states or permanent missions stationed in Geneva as well. So I think that is what it means for the Health Diplomacy Alliance to bring youth right into the conversation, just as due partners in the process of global health. Yeah. Thanks.
Yeah, partnership is such a key message that we got today. I mean, obviously, the fact that we brought so many organizations together just for this webinar, but the fact that, as we mentioned, public health is such a diverse discipline, and our diversity is our strength. And that's such a strong message when it comes to decolonization as well. I'll be really interested to hear about the European Public Health Alliance as well. Obviously, I just mentioned here, public health is quite a broad, diverse discipline. How does that again work with the work that you guys do, Bonnie?
Oh yeah. Thank you, Alex. And I like the answer of Abhishek earlier, focusing on partnership, working with people on the ground. And that is something that we always need to remember as public health professionals. Now, but let me answer this question from the perspective of a student in the Europub Health program. For me, decolonizing public health starts with how we train future professionals. In our program, we study alongside classmates from across the world, people from both countries that were colonized and those with colonial histories. This diversity, I think, isn't just a feature, but actively shapes how we learn. We bring our lived experiences into the classroom, which challenges any one-size-fits-all approach to public health. We discuss how systems are influenced by history, politics, and power, and we question global health models that don't always reflect what happens on the ground. So these are something of the things that Emma also highlighted in her message earlier. So if you look at our classrooms, especially here now that I am in Poland, group discussions and research become spaces where different voices are heard, and where we're encouraged to think critically about whose knowledge counts. And of course, this kind of international setup isn't always available everywhere. That's why I believe every public health program should ask whose voices are missing and how we can make space for them, just like what Abhishek highlighted in his answer, working with people on the ground. Decolonization isn't just a topic for one lecture. It's a mindset we need to build into the new way we teach, learn, and work in public health.
Wow, that's an incredible answer. Drawing again into like the strength of your course. And I love the fact that bringing in more people in your course, as you say, it's not just like it's just a feature of it, and it makes it stronger and more exciting to be in. And I think this kind of ties in a lot with the work that WFPHA does as well. Like the fact that we're wanting to create spaces where people have these conversations, and the fact that we're putting sort of decolonizing global health equity on the agenda. We're putting it in the forefront of Global Public Health Week. We're also putting it at the forefront of our upcoming World Congress of Public Health in 2026. So health equity for us is super important. Drawing on what Emma said earlier and what you guys all touched about a little bit was the whole listening to people and listening to who's missing in the conversation, listening to solutions that we sort of, if you've been colonized, you might not have appreciated being heard, sort of thing. I just kind of want to understand, like, how, if I'm a young person, I'm listening to this conversation, how can I get involved in what you guys do? How can I be heard? How can I also listen to other people around? I don't know who wants to start off with this one. We can give a little wave. Or should I start? I can give a talk about the WFPHA. I guess, yeah, from WFPHA's point of view, again, it's partnerships. Our main things is reaching out to different partners, reaching out to different people who both want to be involved individually. So if you want to be part of Young WFPHA, let us know, send us an email. We can see where you can work, join our work group flow and everything like that. We are also quite abundant in quite a few different places. So you'll find us at WHA meetings, you'll find us at congresses, you'll find us at conferences as well, and again, hosting these sorts of webinars. So honestly, if you want to hear about public health or want to be involved in any of our work, just to keep an eye on our social media and see what opportunities are cropping up there.
I'm not sure if they're with me or not, but if you don't mind if I jump in for a second, I just want to quickly what you just said, Alex, because yes, the Federation has a number of different working groups, and it would be fantastic to see more youth representation across all of the working groups that we have, because there is particular speciality areas. I mean, the young professionals themselves, young WFPHA do a prolific amount of work on our behalf. So anyone's contribution into that space, but any of the working groups, we encourage much more youth participation. So just wanted to add that to your comments, Alex. Thank you.
Okay, great, thank you.
I think
anyone else?
if you would allow me, I think I would like to build a bit on what Bonnie was hinting at, the mindset that needs to change about public health as well. And I was going through the youth manifesto that was drafted last year, and trying to find what is the type of voice that is coming from youth as well, but what is one major aspect of the voice that's missing also. So just to put into context, to try to take a step back to also understand, according to from my perspective, what it means that that public health is decolonized, and why is equity not at the heart of it. So I've come up with, and I've been brainstorming this for the last 2 days. What it means, that public health is decolonized as well. So I think it comes down to 3 points for me. One is that a top-down approach is predominant when it comes to public health. Second is that the scope of work of public health in the way that it is spoken is really very narrow at this point. And third is, what are the type of leadership stories that we are hearing every day from, all nooks and corners of the world. So when it comes to top-down approach, the conversation on, entering the masters of a public health, or, getting yourself educated into a master's in public health, and then entering a reputed organization and then ascending the career ladder, achieving a position wherein you're able to influence policy, work with a lot of other high level key people, and then have impact on communities, is a really great approach. But I think that is just one part of the bigger conversation. And if we need to start decolonizing public health, we also need to start bringing public health to where people are and not asking people to come to public health. So once we start thinking about it in that way, it brings us to try to understand a bottom-up approach towards public health as well. That public health starts with each and every one of us. That the greatest of impact that people on the ground have had on the health of the communities that they work with is not on account of following this linear path of entering into an organization, because the moment you start speaking about that, and the moment there are necessary criteria, it becomes a very exclusive space to be in, and not very inclusive or designed to have equity in it. And it will be great if one day, those people all around the world who are already networking and organizing with each other and trying to find the resources and, solve problems are able to enter those organizations and bring in more impact. Because that way they'll have more center, they'll have more focus, and they'll have more clarity on why they are entering those organizations in the first place. And the network with which they work with are always going to keep them accountable on, what are you doing in that position of power? What are you doing in that position right now? Are you even thinking about the people that you represent and the community that you come from? So I think that is one aspect of the conversation. Second is also the definition of public health itself. So when we start thinking of public health, big programs or projects or advocacy and policy and diplomacy all comes to mind. It's all great, it's all really important, and it is all very impact driving conversation as well. But public health is not just that. Public health is not about public health students or medical students or veterinary students. It's beyond that. It is about each and every professional all around the world. Public health is everybody's business. We are all in public health all together.
Yeah.
And we need to bring it down even to the individual family and community levels as well, when it comes to start having that conversation. So I think that is how I'll echo what Bonnie was mentioning about the changing mindset, about the scope of what public health is, the scope of how individual action matters as well, and what are the leadership stories that we are hearing when it comes to action in public health. Yeah, thanks for that.
That's incredible. Yeah, no, I really liked what you said there about like challenging what the definition is of public health, but also we don't need to just wait for people to come to public health, but bringing public health to people as well, because public health is important for everybody. We've got a really interesting question actually in the Q&A that's popped up, and our audience member asks, it's going to be a long one, so I'll try and summarize it. But how can youth organizations promote changes in health curriculum regarding public health and neocolonial approaches to public health? How can we sort of decolonize it within organizations and within the health curriculum? Is it worth investing in, say, research or evidence studies? Where is the field on this one? I think maybe Zain, would you like to answer this one if it's from a sort of medical angle?
Yeah, thank you so much for this question. And honestly, it's a very insightful question because when we talk about health curricula, we're talking about the foundation that lays every healthcare provider, whether they capacitate them. So it's the foundation that we need to focus on. So how can we even start to promote change in health curricula? It always starts with advocacy for inclusion. Youth organizations like ourselves, we need to advocate for curriculum reforms that integrate not only just the history, but also the context and ongoing impact of colonialism in global health. For me, the idea of colonialism is only a political, and I see it only on the news. The relevance to health only made sense when I started being more involved in the youth organizations. So pushing for courses that focus on global health equity, social determinants of health, and community-based health systems that are rooted in local context rather than one-size-fits-all models, And also, one thing that's very important is partnerships with educational institutions. We work a lot by attending conferences and working with youth networks and so on, but we need to also partner with educational institutions, whether universities, schools, even. These collaborations and sharing of knowledge to highlight the importance of global health equity and the idea of shifting from these neocolonial narratives on health is very, very important. And lastly, there needs to be student mobilization. Students need to be gathered on the topic and demand decolonized curricula, and curricula that is based on local needs and focuses on the context of each country. And the question also highlighted, is research and evidence-based studies a promising path towards that? Well, absolutely. Research and evidence-based studies play a critical role in shifting public health approaches. There needs to be more research on decolonizing health and how does that impact. We need to focus more on community-led solutions, and we need to research more on marginalized communities and show that tangible benefits of decolonial approaches in improving health outcomes. So I hope this kind of summed up the question a bit. And yes, the final answer is yes, investing in research is a powerful tool, and we need to change curricula for sure. And in IFMSA, this is one of our top priorities.
Yeah, that's great. And if I can sort of add to that as well, so my own background as a doctor, I've been sort of in higher education for a wee while now, and I'm definitely seeing within student bodies that we're getting more calls for decolonizing global health. There's within some of the world's leading public health institutes, we're starting to see student-led initiatives to try and push for decolonized curriculum. And I would really recommend, like, you know, if you're at medical school, if you're at university, if you don't already have one of those organizations, why don't you set it up yourself? You know, that's a really awesome thing to do. And again, a little reflection for myself, I was thinking about, like, so I'm from a high income country. I studied in the UK. And one of the things I noticed is that we have a lot of electives. So we send a lot of medical students abroad and things. But we don't necessarily talk about decolonization. We don't almost necessarily talk about, like, you know, why is it that as a high income country, we're lucky enough to go to another country to study, what are we getting out of it, sort of thing. So I think it's also important for us as doctors to identify where opportunities are in our curriculum to put in health equity lessons or decolonizing lessons. I also want to have an insight from the pharmacy world, because obviously, again, I've sort of spoken from the medical side of things, and so has Zane. Mark, do you have any sort of inputs about your curriculum from pharmacy?
Yes, thank you so much, Alex. So with regards to the pharmacy perspective, I just like to bring in that IPSF in itself is representing a 500,000 pharmacy and pharmaceutical sciences students all around the globe, and that is in more than 100 member countries. So as we can see, the impact of equity and decolonization is really important for us as well. So in the pharmacy perspective, I would just like to share my perspective as a student pharmacist, because I do believe that with regards to equity and decolonization, as pharmacists, it's important for us to ensure the access of essential medications to our patients. And we can do that not only the access, but also quality, safe, and cost-effective medications should be delivered to our patients regardless of their background, regardless of their locale, regardless of their predisposition to anything else. So as pharmacy students, as a pharmacy student, I just like to bring that perspective into the discussion, and somehow we can all work forward to bringing all of our initiatives towards a common goal of decolonizing and bringing equity into the discussion. So lastly, I just like to add that recently, IPSF, specifically the Public Health Committee, through my initiative as well, we have been working with UNAIDS and our High Five for HIV project, where we were successfully implementing on-ground projects focusing on stigma and reducing stigma and discrimination in 3 countries, specifically in Kenya, Ghana, and South Africa. And in that perspective, or in that initiative, what I have learned mainly is that the importance of being seen and importance of being acknowledged acknowledged in general, because who are the drivers of this change? And as in that learning, I have seen that the drivers of this change are actually the people on the ground themselves. Because, for example, I am in another part of the world, but it doesn't mean that the organization that I am part of cannot bring change, but that means that we just have to support each other through our partnerships and collaboration, especially in supporting our on-ground teams. So in that, I would just like to highlight that supporting the people on the ground and coordinating with them really shows how we can learn from the people that we're talking to face, rather than simply taking the perspectives of what we can read and what we can access at our comfortability. Thank you so much.
Yeah. No, thank you so much, Mark. And I see Emma's wanting to summarize or pop a wee word in at the end as well. Over to yourself, Emma. Oh, sorry, I think you're still on mute.
Thank you very much. It's just extraordinary to listen to the conversation and to be part of this. Thank you very much once again. And I just wanted to touch on a number of things. And the most important thing is what Bonnie said around decolonised mindset. I mean, this practice is all about decolonised mindset. If we are unable to do that, it doesn't matter what parts of the interventions we want, they will not be successful. And so the focus on how do we create environments and education to truly see a decolonised mindset throughout all of our communities and all of the places and spaces that we need that to occur, which is pretty much everywhere. Recognising that we can't always change the political drivers and the political determinants of health, but if we can change the way decisions get made, by creating more opportunities for decolonised mindset, then we'll have more opportunity for change. And then I just want to go to what Abhishek said about education. The biggest thing that's missing in public health is people's understanding of what public health is. And so if we can all be louder and more clear and together in our message around what we mean when we say public health, which is not just medicine, it is everything, then we will be more successful in bringing everyone along with us on the journey that is the public health journey, which is, let me say, Indigenous health, holistic health. So all of these things, and Mark, you mentioned about being seen and the importance of being seen, and that then brings me to this whole thing around the importance of relationship. There are so many good things happening in good places, but very often not connected up. And so how we can lean into a different sense of being connected with each other all of the time, even in this contemporary world where we're driven by being in these spaces online, what is it that we can do to be together more of the time so we can support one another, to be able to have more of these conversations and do more of these things? And that's what we wanted to do by being committed as a federation to decolonising public health, was to be able to have more conversations, for people to learn and us to do things more together. So thank you very much for having me.
No, thank you so much, Emma. And just in the interest of time, I'm going to ask if Mark, you would be able to summarise the discussion that we've had.
Yes, for sure, Alex. Thank you so much. So I really love the way that everyone brought their own perspectives to the discussion and talking about all the commonalities and our perspectives and what we can take action forward to really decolonize and bring health equity into the scene. So from our discussion today, I think I can summarize it in 4 points. First, we were welcomed by our keynote speaker, Ms. Emma Rosen-Tepatu, where she discussed the importance of health equity and decolonization in public health through acknowledging the barriers and taking action. Next, it was also mentioned in the panel discussion the importance of inter-organizational partnerships and the discussions that we are making across sectors, because through these partnerships, we can make our action more effective and more impactful, because the efforts are not only done by one certain organization, but done collectively by a number of organizations. And the third point to summarize is that the point brought out earlier, that public health starts with each and one of us, that we bring public health to the people and not the other way around. I like this so much because it talks about bringing a people-centered approach rather than an implementer-centered approach to really decolonize and bring equity into the scene. And lastly, what was just mentioned right now is the importance of decolonized mindsets, to increase the decision-making systems that can bring forward the conversations to decolonization and health equity. So overall, we have learned on how we can take action and the various perspectives that are involved to tackle decolonization and health equity. Thank you so much. And now to bring forward to the closing of our event, I'd like to call on Zane.
Thank you so much, Mark, for this summary. And thank you all for joining today's webinar. Your insightful contributions, honestly, were very inspiring. And as we continue these vital conversations, let's remember that the work doesn't stop here, it doesn't stop at this webinar, and doesn't stop with Global Public Health Week. Each of us has a role to play in advocating for systematic change and ensuring that every voice is heard in this fight for a more just global health system.